Hello, I'm Dr. Chaudhry. I'm a general and bariatric surgeon at Advanced Houston Surgical. Our goal is to improve the overall health of people through bariatric surgery, as well as improved diet and exercise. The intragastric balloon procedure is a built-in portion control. The balloons sit in the stomach for a period of 6 months, occupying a large portion of the volume of the stomach, thus reducing the amount of caloric intake, which is the proper way of healthy eating. The balloons do not have to be inserted under general anesthesia. That is one of the advantages of the intragastric balloon. It could be done under light sedation, such that the effects of general anesthesia do not have to be experienced by the patient interested in getting the gastric balloon. A good candidate for the intragastric balloon procedure is somebody between the BMI of 30 to 40 who needs to lose between 30 to 50 pounds and has maybe 1 or 2 medical comorbidities such as high blood pressure, diabetes, or dyslipidemia. The recovery is very quick and easy for somebody who's undergoing the intragastric balloon. There's no general anesthesia involved, so most people are back to work even the same evening after the procedure is done. There is no pain with the procedure because it is without incisions. So the recovery is just like going to seeing your physician in a regular checkup, and you're back to your feet again. I personally, and I think most surgeons, would not recommend an intragastric balloon procedure on somebody who's had a sleeve procedure done, because the balloon is blown up to about 450 cc's, which would not really fit inside a sleeve type of anatomy. The gastric sleeve anatomy is such that the stomach is a lot smaller and would not be able to accommodate the intragastric balloon. Typically, the intragastric balloon procedure costs between $7,000 to $8,000 depending on the facility. This includes the insertion of the balloon as well as the removal and 12 visits with your surgeon over a course of a whole year. The main benefits of the balloon procedure, aside from the 30 to 40, maybe even 50 pounds weight loss, is that it can be done under light sedation. There are no scars, so there's no pain with surgery. Recovery is very quick. People can get back to work the next day. And it's removable, so after 6 months it can be reversed, and it should be, because the balloons need to be removed in 6 months. So there's many benefits, especially for somebody who is looking to lose between 30 to 50 pounds. There is a gentleman who I recently saw. He was about 60 years old with coronary artery disease and was at high risk for having another heart attack. His physician, primary care doctor, requested that he lose weight. He tried with multiple modalities with diet and exercise and just could not get even more than 10 pounds off. He saw me in consultation. We talked about the balloon procedure. He had it done. After the 6 months were completed, he had lost 40 pounds. He was off his high blood pressure medication, and his risk to coronary artery disease had significantly reduced. So that was one of our great success stories recently.